Okay, again, my name's Alexandra, and we're going to be doing assessing the cranial nerves. We're going to be starting with cranial nerve number 4, as we've already, number 5, I'm sorry, as we've done the other ones in previous videos. So cranial nerve number 5 is the trigeminal nerve. We will be asking the patient to clench her teeth while we're palpating the temporal and masseter muscles, okay, for contraction. We want the muscles to contract bilaterally. Any decrease in contraction in both sides is not normal. It's any asymmetrical strength is not normal, or any movement in the jaw may be seen with lesions or injury of the 5th cranial nerve. So again, we're gonna have the patient clench, and clench the teeth as we palpate the temporal. No, okay, yeah. Clench it, like keep doing it, yeah. Okay. So I am not noting, so we're going to do the temporal. Then we're going to go down to the masseter muscles. And there's they contract bilaterally. All right. The next nerve that we are going to look at is cranial nerve number 7, which is the facial nerve. We're going to have the client smile, frown, wrinkle the forehead, show their teeth, puff out their cheeks, purse their lips, raise their eyebrows, close the eyes tightly, and we want the patient to be able to do all of these. If the patient is unable to do any of these, inability to identify correct flavor. Oh, no, that's not right. Inability to close eyes, wrinkle forehead, or raise the forehead along with paralysis of the lower part of the face on the affected side is seen as Bell's palsy. Paralysis of the lower part of the face on the opposite side effect may be seen in central lesions that affects the upper motor neurons, such as from stroke. So the first thing, we're going to have the patient smile. Smile for me. Okay. And then we're going to have the patient frown. Okay. And then wrinkle forehead. Perfect. And then show your teeth. All right. Puff out your cheeks. Okay. Purse your lips like this. All right. And then raise your eyebrows. Okay. Turn a little bit this way so the camera can see it. And close your eyes tightly. Okay. Okay, so the client was able to smile, frown, wrinkle the forehead, show the teeth, puff out the cheeks, purse the lips, raise the eyebrows, close eyes against resistance, and all of the movements were symmetrical, which is what we're looking for. All right, so the next nerve that we're going to look at is the cranial nerve number 11, which is the spinal accessory. We're going to be looking at the shrugging of the shoulders and turning of the head. Okay, so we're going to have the patient shrug the shoulders, and we're going to assess the strength. So shrug your shoulder, like raise it up, and strength is even on both sides. Okay, and let's see. We're gonna have the patient try to turn your head. Okay, let's do it on the other side. Okay, this is assessing the strength of the sternocleidomastoid muscle, and it's a normal finding. Okay. Alright. That concludes the cranial nerve assessment. Like I said, I'm only showing these three on here because we've assessed the other ones in previous videos.